Good day, everyone. I will be beginning the presentation for Group's 10 funding proposal titled Saved by the Bell, Improving Call Bell Response. My name is Toby. We have Candice, Augustina, Diana, and Julia. We will start with describing the problem. So we observed that in acute care settings, hospitalized patients frequently experience delay in receiving assistance after activating the call bell. Now, these delays can result in prolonged wait times, increased patient frustration, and some of the patients try to attempt the task on their own, which can increase their risk of experiencing certain injuries or even adverse events. We've broken down some of the things that we observe into three major consequences, which are prolonged call bell response time contribute to heightened patient anxiety and dissatisfaction, increased medical complications, and unmet toileting needs and pain needs. Moving along, patients feel neglected, vulnerable, and anxious. Increased delays leads to lower trust in the nursing staff and hospital staff. It also increases patient frustration, leading to overall dissatisfaction in nursing care. Delays correlate directly to dissatisfaction and negative perception of care. Faster response times have been linked to higher patient satisfaction scores. In an article by Tez et al. In 2012, there was a study that showed that patients correlated the fact that they were receiving help right after the bell was activated to a higher level of care and thus higher patient satisfaction. Patients attempt to move independently when help is delayed, which can cause further issues for them in terms of increasing fall risk or even just getting hurt. Faster call right response times contribute to a lower fall and injurious fall rates. In the same article by Tez et al. In 2012, he observed that post-intervention, which was in trying to improve call light response, that the hospitals and units that did use this intervention observed a lower total injury rate and fall rate. Delayed call bell responses also worsen untreated conditions, which can slow recovery and increase hospital stays and cost. Delayed call bell responses often leave toileting needs unmet, which can cause discomfort for the patient, urgency, and patient distress. Delayed responses to pain requests worsen patient suffering and hinder recovery. Many call bells we've observed involve pain and toileting needs, and so delays in answering the call bells cause distress for the patients, prolonged suffering, and reduce the trust in nursing care.
Our proposed solution is to launch a call bell response awareness campaign aiming to increase awareness of staff performance, facilitate behavior change, and decrease call bell wait times. There are three integral components of this campaign. First is the implementation of point of decision prompts. These are visual cues or reminders displayed where decisions are likely to be made, leading to a desired behavior. Having a visual reminder at the time and place of a target behavior increases the likelihood that the behavior will occur. Visual cues are particularly effective as they elicit an immediate response to the message, circumventing reliance on prospective memory. Our campaign will use informative posters as these visual cues, which will be placed where call bells are likely to be heard, including nursing stations, outside patient rooms, and in common areas, such as staff rooms and on bulletin boards. Research demonstrates that posters in healthcare settings are effective in improving compliance with regulations. Poster design, however, is crucial to the success of the campaign. The available cognitive resources of the target audience to process the message and engage in the behavior must be considered in the poster design. As healthcare workers typically use a high level of cognitive resources to do their job, we have decided to use a simple, clear, and direct message on our poster that is easy to process. A sample of our campaign poster is provided on this page. Research indicates, however, that standalone posters may be limited in knowledge transfer, thus affecting engagement in the desired behavior change. It is therefore suggested that an integrated approach incorporating a verbal learning exchange accompany poster presentations. When learners and educators are able to interact and exchange dialogue, knowledge transfer is most effective. Accordingly, the second component of our campaign involves education and training for staff and patients. Our campaign seeks to emphasize the concept of sharing the load of responding to call bells. This reflects the notion that responding to call bells is a collective responsibility and does not solely rest on the shoulders of nurses. In fact, all unit staff have the capacity to fulfill minor patient needs in accordance with their scope of practice. When patients require a nursing intervention, however, the appropriate nurse should then be advised. Additionally, educating patients on call bell expectations, such as realistic response times and appropriate usage, has been shown to reduce call bell frequency, thus reducing the load. Throughout the first week of our campaign, we will provide initial education and training during briefing huddles. It is anticipated thereafter that unit leads and managers will continue to educate staff as required. Third component of our campaign involves ongoing engagement with staff to increase awareness of behavior change. This includes disseminating performance data with staff through discussion during briefing huddles and graphical representation of performance trends displayed in staff rooms and bulletin boards. Research demonstrates that sharing performance data allows staff to appreciate the benefits of the behavior change, which acts as a motivator to continue the desired behavior. Our campaign will further support behavior change through the use of positive feedback and incentives, such as small prizes and recognition of exemplary performance. Again, research suggests that this type of engagement with staff positively reinforces the desired behavior, increasing the likelihood of it continuing in the future. Overall, there is a myriad of evidence, as cited in this proposal, to illustrate that campaigns incorporating these three crucial components result in a heightened awareness by staff to the importance of prompt responses to call bells and a commitment to respond to patients in a timelier manner.
Based on this proposed solution, our group came up with the following project plan aimed at improving call bell response times on one hospital unit. This initiative spans 31 days and is broken down into 4 phases: baseline assessment, intervention, post-intervention data collection, and celebration of results. In the first week, baseline assessments will be done to determine the current average response time to call bells. So, with the help of the unit clerk and the placement student, the response time to call bells for the 7 days will be recorded. The average of this data will be the pre-intervention baseline figure for evaluation later. Phase 2 includes several strategies to be implemented from day 8. The first one is the awareness campaign. Posters emphasizing the importance of timely call bell responses will be placed in staff break rooms and bulletin boards. This will be managed by the unit educator and placement student. The cost of such printing 10 posters is estimated at around $120 from Walmart. The second strategy is education and training. Education will be provided during shift huddles, handovers, and in-service workshops, focusing on timely call bell response. The unit educator will lead these efforts. Scripted communication will be prepared and posted by the phone to ensure consistent and empathetic responses by staff when addressing call bells. Additionally, assigned nurses will educate patients at admission and at the start of each shift about proper use of call bells and set expectations accordingly. The third strategy is intentional rounding, which proactively is intended to meet patient needs. Nursing staff will conduct these intentional rounds every 1 to 2 hours, further reducing unnecessary call bell use and improving response times. These strategies will be introduced from day 8 and continued from then. Phase 3 will start from day 15 to day 21, where response times to call bells will be recorded again by the unit clerk and placement student. By the end of this phase, the post-intervention average response time is calculated. During the following next 2 days, the results are analyzed. Average response times to call bells are compared between pre-intervention and post-intervention. Other factors will be assessed as well, and as will be detailed later in the next slide. The last phase is the icing on the cake: recognition and celebration. In this phase, the outcomes are shared with all the staff on the unit by email and bulletin board. To recognize the contribution of all unit staff, because it is a group effort, symbolic appreciation gifts will be given to each staff member. Assuming 84 staff members on a hospital unit, then a total of $70 could be used to purchase such thank you gifts from Temu. This brings the total budget to $190. A small amount invested to create a culture within this hospital unit that prioritizes timely responses to patients, empathy, and teamwork.
To evaluate the success of our initiative, we will focus on both measurable outcomes and meaningful feedback from staff and patients. Our goal is to promote a culture of timely patient-centered care, where call bell responsiveness becomes a shared priority. Our success will be measured by 3 key outcomes. 1. Response time. We will track the percentage of call bells answered within 2 minutes by comparing our results before and after implementation. This data will be collected through either direct observation or time-stamped system data depending on availability. 2. Staff awareness. We will also gather informal feedback from staff through debriefs, shift huddles, and brief check-ins to see if our intervention raised awareness and changed response behavior. 3. Patient satisfaction. Each shift, we will ask 3 to 5 patients a simple question. The staff respond quickly when you use the call bell. Their responses will be noted and categorized as positive, neutral, or negative to guide our future improvements. We have aligned our goals with evidence from peer-reviewed research. According to studies by Zeng et al. 2009 and 2012, faster call bells response times are associated with fewer patient falls and better safety outcomes. One study showed that units averaging around 2 minutes response times had the lowest fall rates, while longer delays over 5 minutes were linked to dissatisfaction and increased risk. Russell et al. 2009 also found that patient satisfaction decreased when response times exceed 5 minutes. So based on this evidence, we have adopted the following benchmarks. A response time under 5 minutes is acceptable, and a response time under 2 minutes is ideal. By combining both objective data and human feedback, we aim to create a more responsive, respectful care environment where every call bell ring is answered with urgency, empathy, and purpose. This initiative is not just about faster responses to call bell, but also creating a culture where patients feel heard and supported.
By increasing staff awareness and encouraging timely responses, we can support safer patient outcomes. Research suggests setting response time benchmarks in order to reduce fall-related injuries. When we align staff behavior with these benchmarks, we can mitigate risk, improve patient outcomes, and reduce associated healthcare costs and legal liabilities. In addition, this increased responsiveness encourages patients to wait for help, creating a safer care experience and reducing the likelihood of avoidable incidents. Our campaign aims to enhance the patient experience. Research consistently shows that shorter call bell response times are linked to higher patient satisfaction scores. When patients feel seen and supported, their confidence in healthcare grows. This contributes to stronger nurse-patient relationships and a better overall perception of care. From a team perspective, the campaign encourages collaborative responsibility. By promoting shared accountability for call bell response across all staff, we ease the burden on individual nurses and create a more supportive unit culture. This shared model promotes teamwork, reduces missed care, and improves workload balance. By setting and tracking response time goals, we can build accountability and cultivate a unit-wide culture of safety and morale. Ultimately, this initiative offers a high-value, low-cost solution that aligns with hospital priority, supports staff, and enhances patient-centered care. It is sustainable and designed to be implemented with minimal resources, making it an ideal candidate for funding and for long-term impact that can be adopted across multiple units.